Here are 3 USMLE-style questions focused on the water-soluble vitamins B5, pantothenic acid, B6, pyridoxine, and B7, biotin. Question 1. A 35-year-old man presents with fatigue, irritability, confusion, and depression. On physical examination, he has peripheral neuropathy with muscle weakness and dermatitis around his eyes, mouth, and nose. The patient reports eating a diet primarily consisting of refined carbohydrates and alcohol. Laboratory studies show a low plasma vitamin B6 pyridoxine level. Which of the following is the most likely cause of this patient's condition? A. Biotin deficiency. B. Pantothenic acid deficiency. C. Pyridoxine vitamin B6 deficiency. D. Folate deficiency. E. Vitamin B12 deficiency. Answer: C. Pyridoxine, vitamin B6. Explanation: this patient most likely has pyridoxine, vitamin B6 deficiency, which is associated with peripheral neuropathy, dermatitis, irritability, and mental status changes. Pyridoxine is involved in amino acid metabolism, neurotransmitter synthesis, and heme production. Deficiency can be caused by poor diet, chronic alcohol consumption, or certain medications. Supplementation with vitamin B6 can correct the symptoms. Question 2. A 40-year-old woman presents with complaints of muscle pain, dermatitis, and alopecia. She also has a history of long-term use of antibiotics for a recurrent urinary tract infection. Physical examination shows scaly, red rash around her eyes and mouth. Laboratory tests show low levels of biotin in the blood. What is the most likely cause of her symptoms? A. Pantothenic acid deficiency. B. Biotin deficiency. C. Pyridoxine deficiency. D. Folate deficiency. E. Cobalamin deficiency. Answer: B. Biotin deficiency. Explanation: the patient's symptoms are suggestive of biotin deficiency, which can occur due to long-term antibiotic use, as antibiotics may alter the gut flora responsible for synthesizing biotin. Biotin deficiency presents with symptoms like dermatitis, alopecia, muscle pain, and neurologic symptoms. Biotin supplementation can alleviate the symptoms. Question 3. A 45-year-old woman presents with complaints of fatigue, muscle weakness, and numbness in her extremities. She has a history of eating a vegan diet and reports decreased intake of meat. On physical examination, she has peripheral neuropathy and dermatitis around her mouth. Which vitamin deficiency is most likely contributing to her symptoms? A. Vitamin B12 deficiency. B. Pantothenic acid deficiency. C. Pyridoxine, vitamin B6 deficiency. D. Biotin deficiency. E. Folate deficiency. Answer: C. Pyridoxine vitamin B6 deficiency. Explanation: this patient presents with peripheral neuropathy and dermatitis, both of which are common features of pyridoxine vitamin B6 deficiency. Pyridoxine is involved in protein metabolism and neurotransmitter synthesis. A vegan diet can lead to B6 deficiency, which causes neurological symptoms and dermatitis. Supplementation with B6 can alleviate the symptoms. These questions focus on the